My name is Jonathan Slade, and I'll be your host today. This webinar is brought to you by RxBio, where I head up product commercialization. So a little bit about RxBio. RxBio is a distributor for Energys Medical Group. We're also manufacturers of the NeoGen device, and they're joining us here today. RxBio is a Canadian biotech distribution company maintaining global infrastructure, focusing our expertise in providing trusted access to innovative medical technologies to the healthcare industry. Our head office is located in Toronto, Canada, with additional locations in the US and Ireland. RxBio executes and adds value by educating healthcare professionals, creating physician and patient access to advanced medical devices while building long-lasting relationships with our patients. Today's session will be focusing on Neogen Psr. A Neogen plasma skin regeneration, or Neogen Psr for short, uses medical grade nitrogen gas turned into pure nitrogen plasma, and this tightens, resurfaces, and regenerates the whole skin architecture in one treatment. It does this with minimal downtime and without puncturing or vaporizing the surface. Neogen Psr is FDA, CE, and Health Canada approved. This presentation will focus on the Neogen Psr device in the USA and Canada. The indications and machine models do vary from country to country. RxBio will reach out to you specifically if you are outside of the USA and Canada to bring you up to speed on model availability and pricing. However, this session still applies to all regions as the technology is the same across all platforms. So a little bit of housekeeping to keep in mind during our session. This webinar will be recorded, and a recorded version of the presentation will be shared with all participants following the webinar, should you wish to recap. We'd love to hear your questions, and please use the Q&A box located at the bottom center of your screen. You can write your questions at any time throughout the presentation, but we will answer them towards the end of the session. I know that there are attendees here today from across the world, and it's very late in the evening and very early for some of you as well. So thank you again for joining us. We really do appreciate it. And just to put that into a little bit of perspective, we do have attendees from the USA, Canada, UK, Singapore, Spain, Pakistan, South America, and South Africa, just to name a few. That's not all of them. So we are quite far-reaching with this webinar. So, okay, let me get on with some introductions. So joining us to assist with our technical questions today is Simon Jones, the CEO of Energys Medical Group. Welcome, Simon, and thank you for joining us.
Thank you, Jonathan. Looking forward to a great session, and thanks for everybody joining tonight, especially Dr. Raj for presenting. So looking forward to it. Thanks, Jonathan. Thank
you, Simon. Now I'd like to introduce you to Dr. Raj Sethi, who will be presenting today. And I'll give you a little bit of background for you. So Dr. Raj is an experienced and highly knowledgeable aesthetic doctor. He runs the Yorkshire Skin Centre with his wife, Dr. Sharon, and provides a truly personalised service with all the hallmarks of good practice. Dr. Sethi has an impressive academic background with a degree in medicine and a first-class honours in anatomy from the University of Leeds. He's also a fully licensed member of the Royal College of Surgeons of Edinburgh. His National Health Service training and years of practice have meant that he works to a strict ethical code, regulation guidelines, and clinical governance. He's a member of the Aesthetic Complication Expert ACE, which is a national organization focusing on improving patient safety in the medical aesthetics. He has also completed a regulated level 7 qualification in medical aesthetics. He's a trainer for 2 international dermal filler companies and runs his own training school, the Academy of Facial Aesthetics. He's recently won an award for the most trusted aesthetics clinic in Leeds. He's regularly published in the aesthetic press. In addition to his strong academic foundations, broad experience, and ethical rigor, Dr. Sethi takes great pride in being a personable, discreet, and professional. So without further ado, welcome, Dr. Raj Sethi.
Thank you so much. That's a really, really amazing introduction, Jonathan. I just wanted to, just before we started, thank you, RX Bio, Energist, Jonathan, yourself, and anyone who's watching from around the world for tuning in. And if it's going to be recorded, you're going to watch it afterwards. Thank you for taking the time out of your day to hear me talk or blabber on, as we'll soon find out. So I'm Dr. Raj Sethi, and it's a great honor for me to be invited to talk on here tonight. I say tonight because right now I think it's about, it's 6 minutes past midnight. So, but it's been a long day, so bear with me, but I'm going to try my best to try and get you interested and get you excited about nitrogen-based plasma skin rejuvenation and regeneration. So, a little bit of background about myself. I think Jonathan's done an amazing job already of explaining, but yeah, so I'm a medical doctor. Obviously across the world you get different letters, but in the UK one of the letters we can get is MBCHB rather than MBBS or an MD. So yeah, I've done my medical degree, a separate degree in anatomy, and then have kind of gone down a surgical training route, and then eventually decided to leave completely and go over to the dark side in private medicine. And now I focus purely, for the last 6 years, we've focused purely on private aesthetic medicine. And I've built up quite, touch wood, a very established practice with a lot of patients and kind of loyal patients and clientele. And over time, I've developed a list of machines in my cupboards that have done what they said on the tin, and some of them haven't done what they said on the tin. And we've had a huge range of patients who've been satisfied and dissatisfied. So I'm always slightly wary when someone comes to me with new technology, because you kind of hear it all before, and it's one of those things where you always feel like you're on the back foot slightly. So I always feel like that, and I'm always skeptical until I'm proven otherwise. I think that's just by nature. I'm a pessimist. So I was always going to be pessimistic when I was about to take on a new technology, and I did my research and I looked at the background of the technology, the company itself, and the infrastructure in place, and how they're going to help me once the sale is complete. Because we all hear horror stories about sales companies that will sell you a machine and then there's no background, there's no background scientific team or medical advisorship or anything that's going to be there as a support mechanism, God forbid, if there's ever a problem. And I can say hand on heart that with this company, Energist, and well, of course, your distributor, RX Bio, you won't have that problem. They are incredibly trustworthy, and it just takes me one phone call. We've had the odd little thing here or there where we're not sure about something, or we're not completely 100% happy with something, or something's not completely right in my eyes, and they've bent over backwards to help us out. So I'm indebted, and I'm very, very grateful to have found a company that actually shares the same ethos as me and as my patients, because they want to have the same support and network to know that everything is going to be safe and sound once they've had their treatment. So without further ado, as I said, I'll stop blabbering on. I'm going to move on to the next slide. So what we're going to cover in this presentation tonight, I'm going to be covering what nitrogen plasma actually is and what makes it unique and how that differs from other technologies that are available on the market, some of which you may already have in your clinics and some of which you may be considering, the indications and what the clinical results can be like, my personal experience to date, and I'll talk more about that a wee bit later, and how long I've had the machine and what we've managed to do with it, and I'll show you some of my cases. And also we're going to do a wee demonstration. Considering it's 6 minutes past midnight or whatever it is now, I'm not going to do a live demonstration. So I actually took the liberty of filming myself and my wife earlier a few weeks ago, and we did a treatment on her, so I can show you, and we filmed it and I kind of edited it down so I can show you how exactly we can do the treatments in real time, and I'll go through the whole thing with you so you get an idea and a glimpse as to how the machine works and what it looks like. And then we'll do some summaries and questions, of course, at the end. And I think Jonathan has told us he's going to be helping us along with those questions as we go through. You guys, if you do have any questions while we go through, please just, I think it's, Jonathan, am I right in thinking they can enter it into the chat box? Is that correct?
Yeah, there's a Q&A box at the bottom center of the screen. If you enter it there, we'll take those questions and we'll ask them separately at the end.
Yeah, and you know, if you guys did want a more personal contact and want to chat with me personally about my experience afterwards, I'm more than happy to organize that, and I'm sure Jonathan will happily help us to mediate that if we needed to do so. So without further ado, let us begin. So what is nitrogen-based plasma? And in all honesty, before I got into this world of plasma and Neogen, I didn't really know much about it. And that's my honest truth. It's not really something that we get kind of confronted with on a daily basis here, at least in England. I'm sure it's probably the same where you are. We don't really tend to think about it. Plasma is the fourth state of matter. This is critical because actually we count it as the fourth state of matter, which we don't really hear of. We hear of solid, liquid, and gases, but we don't really hear about plasma as a fourth state of matter on a daily basis. And that's just because within our realms of our existence on Earth here, we don't really see that much active plasma going on. But in reality, when we step back and have a look at, you know, the universe, 99% of the observable universe is made of plasma. So the sun is made of pure plasma, and plasma essentially is when you've given enough energy to a molecule. So for instance, if you've got a solid, you can give it some heat and it will turn into a liquid. I don't want to teach you guys to suck eggs, but if you heat up a liquid, you're probably going to get a gas. If you heat up a gas high enough, and this is the key, is the ionization and stripping of the electron away from the nucleus, and that separation point leaves you in a state where you're going to have almost like a random state of matter, which is the fourth state of matter, which is plasma. There's been lots of interesting research and evidence over the last 25 years or so. It's building and building on this kind of odd fourth state, because it doesn't follow the same rules as the other three do that we know of. It has its own set of rules, and it follows actually more down the route of quantum mechanics more than it does in kind of what we would establish as a kind of a 3D reality that we live in. So it's slightly more metaphysical to understand exactly how it works. But for our purposes, it works. And I can show you it works. It works really well. So Neogen uses this ultra high radio frequency, which is 2,500 megahertz, and that energy is delivered to nitrogen gas. This is important. We'll go through that in a minute, why it's nitrogen specifically. Once the nitrogen has been heated up and has been this energy has been transferred across, the nitrogen gas molecule will be basically stripped of its electron and it will form nitrogen-based plasma, which in the main part can be sometimes not visible, and in some cases it can come through as a kind of a purpley plume, like you can see. I'm sure you've all seen those kind of plasma balls where you touch the surface of the glass and you can see the kind of electrical charge flying out to touch your fingertips. You know, I think they were popular back in the 90s. I'm sure most people are from my generation here, but that's pure plasma energy in a kind of in a form of a electronic gadget that's used for recreation and you know, just for putting on your table as a commodity. But for this purpose, we can harbor the power of nitrogen-based plasma for our patients to create a new type of skin rejuvenation treatment that in all honesty, I haven't really seen anywhere else, and I haven't read of any other machine that can do this in the same way, which was the one thing that excited me and got me interested in it. So when we're talking about plasmas, there's loads of different types of plasma that are available within the medical aesthetic arena. For instance, argon has been used for a long time for wound healing. My background, when I was in the surgical practice, we used to use an argon plasma beam to sometimes perform liver surgery, and this was a type of cold plasma. There's different types. So argon has been used for a while. Helium has been well established. It kind of cuts, coagulates, and ablates. It's an open surgery. It can be used under the skin as well. It's called J-plasty. There are pros and cons to those things, including the level of heat that can be generated, it's not always a good thing. And there can be advantages and disadvantages. We need to look into those specifically so we get a better idea of how helium can be used and how where it would potentially lack or fall behind. And then nitrogen. Nitrogen is what this whole talk is about, and it's a very, very special gas in this regard, because when it turns into a plasma, the heat that's generated can be very, very tightly controlled depending on the level of energy that we're transferring to the nitrogen, and thus that energy will translate into a predictable outcome for our patients, depending on the energy we use. And the exact window of the temperatures when you've made this nitrogen-based plasma, that window of energy will mean that you'll get a really, really tight rejuvenation and a very, very reliable and predictable result, which is exactly what we want in our clinics. I don't want anything that's going to be unpredictable. I want to make sure that whatever we get is going to be reliable and it's going to tighten, resurface, and regenerate the skin, as it says there, but it does it within a safe framework where it's not going to cause my patients any harm. The final gas that we can see here is the atmospheric air, which is basically a complex cocktail. And this is a kind of an umbrella term for several different devices, including plasma pens, plasma showers, and fractional plasma. I think the problem is that plasma sometimes gets a bad name because it gets grouped in with these machines. I remember when plasma pens first came out, and I think, they were, I mean, there are a few very reputable companies. I'm not sure about the US and the market there. Obviously, everything has to be FDA approved. But in the UK and in Europe, it's a bit of a free-for-all, and anyone can get a plasma pen and just start. My hairdresser, well, I don't have a hairdresser, but my wife's hairdresser has a plasma pen in her hair salon, which is absolutely ridiculous. These are very, very, very potentially dangerous devices, and they can be bought for something simple as $200 or something, or £200, just straight from China. And it sometimes it's quite demeaning, and it can bring the whole kind of connotation around plasma. It can bring it down into a pejorative, and we want to step away from that. And I want to show you why we should elevate and why we can bring nitrogen-based plasma into its own realm, which is where it should stand and where it should deserve that position. So we're not talking about platelet-rich plasma. We're not talking about blood-based kind of plasma. We're not talking about plasma pens, which, these, I'm sure you've probably seen these pens that create these kind of little microscopic jars. I've had patients come into my clinic in the UK where they've come in approximately maybe 6 months or even a year after they've had this treatment, and the scars haven't gone. They're still there, which is awful. And these patients can be psychologically and physically traumatized by this kind of procedure, and they really are on the back foot. They don't trust anything anymore because they've had a bad experience. And if I was to say, I can fix your scars with more plasma, in many cases, I've had quite a lot of rebuttal from that because people don't believe me. And it's because it gets put into the same bracket as these plasma pens. So it's our responsibility as medical professionals to make sure that we educate the patients, educate the public, and make sure they understand the differences between the different types of technology. And I've been doing that quite hard on my own social media and stuff, but it's a collective responsibility that we make sure that our patients are fully informed before they make any decisions. It's also not light and lasers, and this is important. It's different from that kind of framework, and it shouldn't be mixed up with those. Importantly, there are light sources that we use, for instance, even fluorescent tubing light, which uses the same principle of plasma. Even a neon light will use the same principle of creating light energy as a byproduct of ionizing the gas inside the tube. So yes, there is light as a potential function, but for our purposes, it's not light energy that we're using, it is the plasma energy. And you'll see as we go through what I mean by that. So it's a non-fractionated plume of energy that's going to be coming out of the tip of the handpiece. It doesn't rely on a specific wavelength, and it actually relies on this temperature range, which we can, as I said, control between 70 and 165 degrees as it hits the skin surface. And that's really important because it means that we can do very superficial treatments. If you're going to go for a lower level energy and you want someone who's just having like a spa-like facial, for instance, you can have a very superficial level of energy and it'll give a nice rejuvenating result with minimum downtime, all the way through to something deep and hardcore and comparable kind of ablative CO2 resurfacing. And we can go through the whole spectrum of that, of the downtime and of the results, depending on how hard we want to go. And we've just got to counsel our patient and make sure that they're fully informed as to what they're getting themselves in for, what their predicted downtime is, what it's going to look like. I show them, you know, the ugly, the truth about what it's going to look like. And I found that actually once you've had that conversation and they have seen photos of what they may look like, almost all of the ones that I've shown it to have said, oh, initially like, oh God, that looks awful. And then suddenly they actually see the result and, you know, they are sold. And I think it's the principle that I think although we should be selling the results, I think it's important to make sure that they are aware of the way that we're going to get there. You know, I'm sure we can sell tickets to, I don't know, Hawaii, but if I tell them they're going to get there in a pedalo boat from the UK, it's probably going to be a difficult sell. So making sure you speak to the right patients about the right problems and the right solutions is critical. And we've got to pick the right patients here. But the thing with nitrogen-based plasma and the Neogen system is that it's so broad and it can cover so many different indications. It's one of those things that I'd have to sell it very hard. I just put a photo up on social media and I get people flocking to my phone lines asking me to book in and get a consultation for this treatment. And I think that's where, because of the amount of different indications, which we'll go through in a few minutes, that's where it really comes into its own. Plasma, so the plasma thermal energy readily, so it permeates through the skin and it's using these high temperatures via water. So it transfers and permeates via water. That's important. So we want to keep the skin as hydrated as possible. So in the treatments and in the protocols from Energist and RxBio, they're normally advised to make sure that the patient has been very well hydrated in the days coming up to the treatment. And then on the day of treatment, we normally use a kind of a hydrating mask prior to the actual treatment to make sure that we can get enough, as much water as we can into the skin, which will mean that the energy that's transferred will go further, will do more for the patient and they get a better result. It also has some interesting antimicrobial properties and can be used for active acne. And also once it's actually, once the treatment's been performed, there's all of these channels have opened up and it can mean that we can really, really get in active ingredients into the skin. And for instance, growth factors, or if you want to use PRF, I'm going to show you how I've used various different other modalities and treatments at the same time to try and get the best results. So you can really utilize that transdermal drug delivery system that we're going to create by creating these open channels. But importantly, it does not char the skin. There is no charring. And that's critical. Didn't really go through it properly a second ago, but in the last slide where I was talking about using air as a medium for instance, plasma pens, it's important to note that with air, you have got oxygen. So you can create plasma from air, but then you will have oxygen molecules mixed in with your plasma. That has two problems. So firstly, your concentration, the strength of the plasma is not going to be the same. And the second aspect is, because you've got oxygen present, oxygen is a fire starter and it will char the skin. So that's where you're getting all of those microscopic little burns that we're just going to go back to the previous slide. You can see those little microscopic little charring burns that you can see. That's visible charred skin because of the oxygen present inside the atmosphere. The important thing with nitrogen-based plasma is that the pressure that's generated by the machine and the power that's generated as that plume comes out, and you can see that plume in the kind of schematic just firing away there, the energy that's associated with it, as it comes out, it pushes atmospheric oxygen out of the way, which means that by the time the energy hits the skin, there is no oxygen present because the oxygen has moved out of the way to make way, parts way for this plume to hit the skin, which means we don't get any charring of the skin, which means the outer layer of the skin remains intact. It does not have a broken surface. It does not have areas of charred or even vaporized tissue. It stays intact, which is very, very important for the way that the healing will then, the associated healing will then commence, which we'll go through in a second. So how does it work? This little wee animation, it's very short, but here we can see the gas traveling through this little glass pipe, and we get the ionizing, the little spring there. As it goes through, radio frequency energy is going to be transferred through. It's going to, and then once that plume has hit the skin, we can alter the joules. We can see the red portion and the yellow portion. We're going to go through those deep in a minute in a bit more depth, but we can see that as that happens, the energy is being transferred through to the skin and is going deep inside the skin. And the depth is dependent on how much energy you want to use. So you can change that variable based on your patient's skin type, on their perceived downtime that they want. And here you can see the thermal damage zone and the thermal changing zone, which we're going to talk about a wee bit more in a second. So once that's happened, you're going to get this layer of non-viable tissue that's not going to be of any use. That will flake off by itself as time goes on, and the underlying skin gets a massive hit and a boost. And basically just the way I explain it to my patients is I just say the underlying skin gets a reboot, and it makes it think like it's young skin again. And we see the outer layer of skin will shed off within the first few days, depending on how deep we want to go. But the underlying skin will have ongoing improvements and ongoing architectural changes that will occur for 3 to 6 months, potentially. It will keep on improving. And as we do more and more treatments, if you did more than one, for instance, you don't always have to, but if you did, you're getting ongoing improvements, even months or even potentially up to a year after a treatment, because there is ongoing stimulation still occurring. So here are the two little zones that we talk about. So we can see that the plume is coming down. There is a zone of thermal damage, and then there's a zone of thermal modification, which is the area where you're going to get still viable live tissue. And you can see the red line in the middle is that level of where we kind of say that that is the transition zone, where you've got above it non-viable tissue and below it tissue that's going to regenerate and remodel. And we can go all the way from just pure epidermal treatment, as we said, a very light treatment, superficial. And I've had 3 personally. All the way through to, if we were to go down to the higher energy levels, like 4 joules, for instance, we are hitting the reticular dermis, which is fantastic, because in order to, when we hit the reticular dermis, we know we're going to get serious rebooting of the skin's architecture, and the way that that's going to unfold is predictable but also reliable, and it's more reliable than other ways that we could have eventually got there. I'm a big fan. I mean, I don't know which countries you guys are from and whether you've got this access to it or not, but Dr. Abaji's Zeo, we use a lot of Zeo Skin Health in our clinic, and Abaji Medical as well. And I was a big fan of the blue peel, or the control depth peel, and this is a deep peel that's going very deep into the skin, and it is going to the level of the upper reticular dermis. I'm getting great results with it. However, it is completely unpredictable, because you're using your eyes as a gauge as to whether the blue of the skin has gone blue enough before you can stop and help to try and reduce the effect of the acid that you put on the skin, which basically means that you're relying on your eyes and your ability and your experience to work out whether this treatment's going to work or not. And there was just a lot of very sleepless nights when I did that, and I didn't really feel very comfortable. Don't get me wrong, the results were great, but there is an equal possibility that we could have had a really big disaster as well. If there was an issue, it's not going to be a small issue, it's going to be a very big issue. With this machine, because of the reliability and because of the way that energy is hitting the skin and causing that zone of thermal modification in a very predictable manner, I am not keeping awake at nighttime. I'm sleeping very well with both eyes closed, and I'm waiting with a lot of excitement for my patients. I get them to email me photos on a daily basis. They always send me photos. When we're doing a deep treatment, they always send me photos like, oh my god, what's happened? And actually, when you've spoken to them and you've shown them what they should be expecting, you'll see that actually it's very predictable and very reliable as to exactly how their downtime is going to unfold. Superficially speaking, there really isn't that much. It's kind of like 4 to 7 days max. Even of that, there's going to be 1 or 2 days where they look a bit iffy. As long as you counsel them and you inform them of that, patients will make time and make way once they've seen the results in action. So here is a little kind of thermal image using an FLIR camera, and it's a little video, but you can see as the energy is hitting the skin, you can see the plume of that red energy as it hits the skin surface. And it's a fantastic piece of kit because you can see the ongoing heat inside the tissues despite the probe moving further down. There is still residual heat inside the system, which is exactly what we want. We want that ongoing stimulation to occur as long as it can. This is an interesting slide, and this is actually one of the ones that sold me when I first heard about it. So this is a rather peculiar shaped graph, but just bear with me and I'll explain what's going on. There's three basic columns there. There's first pass, second pass, third pass. I'm sure you can all see them. We can also see along the x-axis, there's the depth of which we start at the stratum corneum, the outer layers, and the epidermis, and then down to the dermal layer. And what we can see is that when you're on, for instance, there's an example here of 4 joules as the energy. When we're going over that first pass, we can see that the energy is being transferred super deep. And the temperatures are hitting, for instance, in the dermis, we're getting up to 62 to 75 degrees in the dermis, which is fantastic. That is an amazing temperature to get thermal modification. And as we go through, what happens is because of this layer of non-viable tissue, you get this zone of what we call vacuolation, where the energy is going to struggle to be transmitted through. So the next time you pass over the same area, it makes it very difficult to get the same energy down to the same level, which on the face of it may sound like it's potentially a drawback, but actually it's quite the opposite. It is a very, very, very positive feature, and it's potentially very, very protective, because it means that you are going to struggle to do damage, because it means that when you've hit that second pass, you're ultimately going to be reducing the amount of energy that's going to be able to get down to the deeper layer. And when you do the third pass, it actually shows that you're not going to be able to get down anywhere near as deep as you were before, which means, again, it acts like a protective function, which means that you'll get, I mean, I'm not saying you can't do damage with it. This is a powerful piece of kit, and appropriate training is required, and you'll get an amazing training when you get your machine, or even when you do your demos. You'll see the power of the machine, and I'll show you a wee bit later on what I mean. But it shouldn't be underestimated, but there is this kind of safety feature that's inbuilt into it is fantastic, because it gives me the peace of mind to know that I can do the treatment. I can do a few passes on the skin, but this treatment will stop me being able to cause damage to layers that I didn't want to cause damage to, because of this zone of vacuolation, which just means that you're not going to get the same energy transferred as you would have done if you just left it and there was no control. You could just go over and over, and you could potentially cause a disaster. But if you've got this intact and it's part of the function of the machine, it's really, really nice to know as a clinician that I've got this in my back pocket, to know that it's not going to be able to do something that's going to be potentially harmful for my patient. So how does it work? This is a slow motion treatment. I can't believe I caught this on my iPhone, but I'm very, very impressed with myself. So I'm just going to take in a second to gloat. So listen to the noise. Isn't that amazing? I was like, wow, this is, it's very cool. It's very sci-fi. It's very, yeah, I mean, I could watch that all day long. So the slow-mos of it are fantastic. You can see the plume in action. But notice on the skin surface, there is no charring. There's nothing to see. All you see, actually, you can't see it very well here, but you get this kind of sheen. And that's all you need to see. That's all you need to know, because you know then that the Neogen has done its job. There are 2 main nozzles on the end of the handpiece. There's a 5mm nozzle and a 25mm nozzle. And the simplest way to think about this, obviously, because the 25mm nozzle is a wee bit further away from the skin, you're going to have less energy being transmitted. So that's for a lower energy treatment. If you're using the 5mm nozzle, you're going to go into the higher territories where there's going to be a bit more downtime, but significantly more transformative results that can occur from that. So it regenerates the whole of the skin architecture. So here we can see day 0 following a 3.5 joule treatment, and then day 10 following a treatment. We can see histological changes. We can see the thickened dermal epidermal junction, the densifying of the dermis, and a thicker epidermis as well. And that's really, that's quick. That's 10 days we can see these changes occurring. And even for this person who had a 3.5 joule treatment, the dead layers will have already been shifted away, and we can just see this new uniformity and homogeneity in the layers of the skin, which just make it look healthier. And the patients notice it because they get a glow on their skin, which they haven't normally had for a very long time. And that's one thing that all of the patients who have had it have said, is that they've got this glow, and it's just because they've got some of the dead layers away. You're looking through the frosted glass, we've taken rid of the frosted glass, and we can see the skin underneath now. We can see the rosiness of the blood vessels, and everything's just looking a bit younger and a bit firmer. And it's that's across the board. It's a uniform piece of feedback that we've got from our patients. So benefits of the treatment, the kind of USPs. So firstly, we're using thermal plasma, not light energy, which is really critical for purposes of reducing risk with regards to, for instance, things like hyperpigmentation or hypopigmentation that can happen with laser and light energy. We're not using that technology. So it is FDA approved for skin types 1 to 4 in the US. But when we're, from a personal point of view and subjectively speaking, there are treatments that we can perform on darker skin types, and I have done that. I've had it myself, so I can speak from personal experience, but it's not with an FDA accreditation, so it's going to be off-label use, but we can talk about that later on. Treated skin remains completely intact. So here you can see a picture of a patient who's had a laser treatment done and has developed a post-procedural infection locally in the skin. There's a staph infection and potentially a small abscess that's collected underneath the skin because of that treatment. And that's just because you've made an open hole inside the skin surface, and if you've made a channel that's going to be open, you've potentially created a wound, and if there's a wound, there's always a risk of infection. The beauty of the Neogen means that because you've got a fully sealed layer, which is the non-viable layer that's just been toasted, it's still completely intact, which means nothing can get in. So the ability for microbial kind of infestation and infection to ensue is very, very low. We clean the skin thoroughly. I'm a sucker. I always clean the skin with kind of hypochlorous before and after every procedure because it's just part of my practice. But it's the reliability to know that you don't actually need to do that. And actually just doing the treatment itself is enough to firstly create a seal and an amazing tissue regenerative response. But secondly, it's actually used for the treatment of active acne. So it kills bacteria. It's part of its job. And it will actively destroy bacteria that are related to acne. We've used it for loads of some of our younger patients who've suffered with acne. We've got several patients on the go right now that are coming in for kind of every week and a half or so. They're having a little mini treatment with our Neogen, and it's just killing the bugs and giving them the support, and they can see the improvement week on week as their acne starts to slowly recede, which can be really, really, you know, it's a soul destroying condition. It can give you a lot of mental health issues, and the reduction in the possibility and the risk of scarring is phenomenal. And if you can try to do that in any way, shape or form, we should. And of course, with the Neogen, yes, we can treat the acne, but at the same time, it's also treating the acne scarring, because we're going to get this amazing collagen response that's going to happen in the skin over the next coming months. We can tailor the treatment to meet the client's needs. So what I mean by that is essentially, if you want the patient to have a superficial treatment, then you can tailor it completely. And if you want them to have a medium or you want them to have a deep, we can change those settings and we can go up and down. We can dependent on, I've done that on a few patients where we've started off a bit lighter, they've liked the results, and then we've basically negotiated and found a middle ground where we're both happy, and we've gone a bit harder. And they love the results because they've already had a stepping stone into it. So you don't always have to go hard or go home. You can go softer and see how a patient builds that trust with you over time. And then if you wanted to, you can go for something a bit more advanced. regenerates the whole skin architecture. So that's key and critical. The skin tightening, skin resurfacing, and improvement of the whole skin architecture, which you don't really get with many of the systems because they normally target one aspect of it. I've got another system in my clinic. I mean, I'm quite open and quite happy to talk about it. I've got a Morpheus 8 machine from InMode Aesthetics, which I've been using for the last 3 years now. And it's a fantastic piece of kit. I think it's great, it works, but in terms of the reliability of the results, I am yet to see a streak of patients that have all had an amazing result, and I'm very, very happy with it as well, in all honesty. And I get results, but there's a bit occasional hit and miss. There's patients who I've had to give refunds to for thousands of pounds because they've had a course of treatments, and we're sat down with the before and afters, and you know, it's awkward when you can't see a difference and the patient can't see a difference, and then you both sat there looking awkwardly at each other. I'm not one to sit there and pretend, you know, the emperor's new clothes are there and everything's going to be hunky-dory and they've seen all these changes and look at the way the light's hitting their skin. If it's not immediately visible, I know my patients aren't going to be happy. I don't know about yours, but my patients aren't going to be happy. So we need something that's going to pack a punch. It's going to give them bang for their buck, and it's going to give them visible results that's going to be predictable and also quantifiable. So we use a skin scanner as well, so we can show them the lines and wrinkles they've got before and after. So it's not just on visible photography, which I'm sure we all know. People play light tricks all the time on Instagram and Facebook, and you can make someone look like they've just had a deep platysmoplasty and a neck surgery just by changing and turning on a light in the corner of the room. You know, lots of fun things happen on Instagram, but actually patients want reliable results. And nowadays patients are really clued up. They're so informed, and they come in and they go, oh, look at this practitioner. They just turned the lights on and it looks like they've had a tear trough treatment. And I'm completely astounded because actually, yes, that's exactly what's happened. And half the time it doesn't look like they've had any treatment at all. So we want something that's reliable, we want something that's quantifiable, and that's fortunately, the way the public are now moving is more towards this informed state because of the internet and because of access to information. It's the age of information. They are coming in far, far more informed about these things. I've been pushing this quite strong in the UK, and I've now got patients up and down the UK, even within a few months of having the machine. And I've been, you know, there's been several people pushing it, but in terms of the feedback I've got patients up and down the UK now traveling to come and see me, to come have this treatment done with me. So it's fantastic. If you give the right message out and it's echoed appropriately by the right people, you can really build a very strong foundation just on one machine alone. So uses thermal plasma energy, not light. We already know that. We can look at this table of complications and compare it to things like CO2. This is a published paper by, if you look at the last name on the source there, it's actually Fitzpatrick himself, who actually was summoned in this paper and actually did some work. And you can see I'm not going to go through that list because it would just be embarrassing to go through it. You can see the numbers and it's ridiculous. You know, the pigmentation and hyperpigmentation risks associated with CO2 compared with nitrogen-based plasma. We can see it's such a critical high significance of difference between those two columns. Why the hell would you not go for nitrogen-based plasma? It doesn't make any sense to me. The fact that you can treat the FDA approved type 1 to type 4 and then off-label potentially if you wanted to or needed to. Again, we can talk about that if you want to. You don't need corneal eye shields. I can treat right up onto the lashes. I can go onto the actual upper lid down to the lashes. So I'm treating on the surface of the globe, but I don't need any corneal eye shields, and I can go very, very high energy there. I also don't need a laser controlled area. I don't need signage and I don't need special qualifications. I need somebody, and a lot of the treatments can be done by my therapist, which is fantastic because it means it frees up my time for other more, for instance, invasive treatments. Or if I wanted to, it frees me up for more. If you've got two machines, that's great. You can do a deeper treatment while your therapist is doing a more superficial one. So it means that you get a lot more time back and less complications. We don't need to wear corneal eye shields. I always get a bit wary if a treatment requires corneal eye shields. I always just feel slightly precarious about the whole thing, because it means that there can be a level of danger to the trauma and trauma to the cornea, which is obviously something we don't want at all. So treated skin remains completely intact. We've already been through this as a natural biological barrier that happens. If you compare that with things like ablative lasers, where there's going to be a potential vaporization or a puncture in the skin, or even with Morpheus 8, for instance, there's a needle punctures inside microneedling, and the fact that there is a fully sealed layer, it will promote faster recovery and improved outcomes with lower risk of potential side effects, which is exactly what we want. So, as I said, we can tailor the treatment, we can change the number of treatments, we can change the energy setting, we can change the number of pulses that we use, that we can combine it with other things, and we can use post-procedural adjuncts as well. So, and of course, in terms of the treatment itself, we can consider the health of the skin, the quality of the skin, the color, and we can target specific indications as well for specific skin concerns. Here we've got a wee table of the potential downtime that's associated with each of the levels of treatment. So you're starting with a 0.5 joule treatment. You're probably looking at most skin types will probably just be a 1 to 2 days of downtime. If you're going further up the ranks, you can see kind of the 1s and the 2.2s and 2.5. You're looking somewhere between kind of 4 and 7 days. And if you're going up to the level of 4 joules, 9 days, I mean, this is an average, but I've had patients where they've got better within 8 days or so, and I've got patients where it's taken them up to potentially up to a week and a half or 2 weeks. It just depends on how that patient individually is going to be responsive to that treatment. So you just got to take that into account. And it's better to be progressive rather than aggressive. So if you want to start on a lower level of energy, get them used to it, and then bring out the big guns later, that's great. And it means their response will be better as well. And they're more likely to be able to cope with the deeper treatment if you've already got an idea psychologically and physically and how it's going to perform on a more superficial level first. So as it says at the bottom there, patients can experience less downtime on the second and third treatments. So this is a cool slide which shows you, it's metaphorical, it shows you the point of the slide is that you've got various different modalities. They're all going to be hitting the skin in one particular way. So you've got HIFU, IPL, radiofrequency, ablative, fractional laser. They're all hitting the skin and they're giving you one exercise. Neogen is using the whole skin architecture. So it's like doing a circuit rather than just doing a spinning class or using some dumbbells. We're going through the whole skin, we're using the whole skin architecture and we're making the skin work for us. And the skin's doing all the hard work and we're just sat back and watching the fruits of its labor. So it's making it work all the way down to the reticular dermis, which is absolutely fantastic, which you can't say with other treatment modalities. It just doesn't have the same effect. So some results you can see here, regeneration of the skin. This is literally 8 days later. This is not my result. You can see here there is reduction in our acne scarring with 1.2 energy, 2 passes. This is so 1.2 to 3 joules of energy and 600 shots, which isn't that much. It sounds like a lot, but when you actually start in the treatment, shots are very, very quick. You can fire a kind of quite fast to a kind of 2.5 hertz per second. So 600 shots doesn't last very long at all. So 2.5 shots a second it's fantastic. You're going to get a very quick treatment. I can potentially do a full face in about full face and neck in maybe about 20 minutes. So it doesn't take very long to do at all. We leave them numbing and pain control is important. We're going to talk more about that in a minute, but we normally leave them numbing for a deeper treatment. We leave them numbing for about 45 minutes. We've got a nice little comfy numbing room they can go into and they can go and sit in a lovely comforting massage chair, and then we will bring them through into the Neogen room to perform the treatment. So it kind of works in a cycle, so it's quite useful. But yeah, that result is astounding. 8 days later, in someone who's got quite marked box scar and rolling scars. I think there's a few ice pick scars in there as well. To get all of that result in 8 days is fantastic. Can see that process here. So 1.2 to 1.8 joules for full face and or 3 joules spot treatment over the deeper scarring points, and we can see that journey. And this is a very predictable and very, very average journey of someone who's going to be having this treatment. We can see those darker marks that pop up. They normally pop up on day 2, day 3, and then they tend to get darker and darker. And then suddenly, all before you can see, it looks really bad, and suddenly they're just peeled away and they're gone before your eyes. And then by day 8, it's gone. And that's exactly what happened to me. I've had 3 treatments. I've noticed my downtime has got less every single time I've had it. I had it because I wanted to see what the machine was like, but also my personal problem is I have some chickenpox scarring on my face, and I noticed that my chickenpox scars reduced by probably about 40 to 50%, I'd say, in the 3 months after having 2 treatments at least. They halved in their depth, and as someone who's in the industry, I've tried to throw everything at these little buggers, but I haven't yet to see a result that's matched the Neogens, to be honest, which is one of the reasons why I bought it. So this is an interesting slide. Sorry, it looks a bit busy, but this basically shows you the benefits of the Neogen over and above other similar modalities that may be using similar plasma-based systems or other technologies. So there's helium plasma, plasma pens, shower, fractional plasma, and then the other ones are things like ablative CO2, non-ablative fractional CO2, and RF microneedling. So we can see as we go through those different categories, treated skin remains intact, regenerates the whole skin architecture, tailorable to the skin treatments to meet the needs of the patient's face and body, simultaneously tightens and resurfaces, is effective for the use on the eyelids, and effective with other combination treatments, and relative risk of post-procedural complications. We can see the Neogen is ticking all of the boxes. Other machines are ticking boxes, but not as much as the Neogen. So you're looking at kind of quite severe technologies with a lot more downtime in comparison. Things like ablative CO2 or non-ablative fractional CO2 that will be getting close, but not exactly the same. And the downtime associated and the risk associated with those we've already been through. So we need to take all of that into account when we're bringing up our choices to our patient. We need to make sure that we go through all of the different options. In the UK, we've got a legal and a medical ethical obligation to make sure we discuss all of the options available. It's called the Monroe Principle. In the UK, it's part of our kind of legal framework, is that we have to go through all of the options of whatever treatment we're offering and not offering. So if there's another treatment that's offered elsewhere to fix the same problem, we have to legally go through that as well in the consent process. So I actively do talk about CO2 and plasma pens and all those things, and I can show them a table similar to this, made specifically for the patients. And that I don't need to say very much. It explains everything very beautifully and visually, and they can basically sit there and easily compare the various different platforms and what the technologies are going to offer them. So what can we do with it? So we are looking at on-label, and there are some off-label uses. On-label, so these are FDA approved for skin types 1 to 4, actinic keratosis, viral papilloma, superficial skin lesions, seborrheic keratoses, acne scars, facial rhytids, and then non-facial rhytids, so basically body treatments. So those are all the FDA approved for 1 to 4, skin type 1 to 4. There are, however, lots of off-label uses as well, which include things like scar revision, photo damage, pore size reduction. A lot of these are kind of happy side effects. When you do the treatment, you'll suddenly look back at the before and after photo. And I've done it now where I look back and I'm going to go, oh yeah, they look really good, but why do they look good? And we sit there and we look at it and we actually go, oh my God, it's ticking about 7 of those boxes. And some of the boxes we didn't even know existed. Problems the patients didn't even know they had with their skin have now suddenly been fixed, just as a byproduct of using the system, which is fantastic. And so we've managed to tighten some eyelids. I'll show you that. We've got some jowl lifting. I've combined it with other treatments, including face tight, which is a big kind of hot rod in the neck. And I've also done threads with it as well. Pore size is without doubt on every patient we've done it on the pores have disappeared, which is fantastic. And some patients have had really, really big, strong open pores, and they've completely been obliterated, which is always a positive. the patients. As I said, we've got a few patients we're treating acne, active acne with for more younger patients who potentially got hormonal issues underlying and stuff. So we're trying to do it from the hormonal point of view, and then also supplementing it with some topical, supplementing with some procedural elements from Neogen. Facial rhytids, I'm going to show you the most amazing old lady who is super cute, and she's traveled from very far to come and see me. And when she came and saw me, I basically just threw a flamethrower in her face, and she looks absolutely fantastic now. So I'll show you that in a minute. But one of the deepest cases I've done. But I'm going to show you a full range of cases from very superficial to very deep, so you can get an idea of what you can do with this. And it's that flexibility that you have as a practitioner and a clinician, which is fantastic. You can go for superficial stuff, or you can go for the deep stuff. You can do what you like. And we've treated a few actinic keratosis. We've treated a few viral warts with it as well. We've made a few TikToks with it. It's fantastic. It's a great piece of kit. So treatment experience, we've got our consultation kind of day -10. So things that they can do at home, and we're going to obviously do the consent process, get them to think about it, give them the leaflets, give them all the information they need. Then there's a bit of prep, which essentially is to avoid direct sun. We want to make sure we don't use any fake tan on the skin, and we want to drink lots of water, hydrate them. On the day of the treatment, we'll use the hydrating mask and then pain management. And there are various different pain management routes we can go down. You could just use a very simple topical lidocaine-based cream, something like a 4% or something, if you're going to do a superficial treatment, through to if you're going to do medium or deep treatments, so you need a bit more control. We've got something that's kind of a BTL, so it's kind of like a benzocaine, tetracaine, lidocaine mix, which is about 27% or so, which you can get compounded in a kind of a paraffin base. Or if you wanted to, you could go for a block. So for some of the deeper treatments, I just went in straight with some lidocaine and just did a block. And it's very simple, it's very quick, and it works. It works very effectively, and it saves a lot of time as well. So you can choose what you want. On top of that, depends on what the patient's requirements are. We've got other potential avenues for pain management in our clinic, including things like nitrous oxide, where you can use gas and air. We don't use it regularly. We've got it as a backup. We haven't had to use it yet, but it's there. It's mainly I bought it for the bloody Morpheus, to be honest. That's the truth. So I bought it for the Morpheus, and it hasn't really been used for the Neogen. But people for the Morpheus, yeah, they're dying. It's awful. It's so painful. I wouldn't have it done personally, even though it's my machine. And then afterwards, this is the downtime bit. So, kind of high energy, 7 to 10 days. I think that's probably on the lower end. I think it's probably a wee bit more than that on average for the ones that I've seen at least. But medium, mid energy, probably about maximum seven days or so. And low energy, about 1 to 3 days of where it's going to be looking a bit funky and a bit odd, but then it will settle down very quickly. You're back to normal. Skin will be visible new skin's visible within a few days. You're always going to look fantastic when that's done, and you can have ongoing collagen stimulation and improvement over the coming months. So recovery profiles, this is just to show you what the recovery looks like, so you can see it's not that bad. Once you've kind of become desensitized to it and you show the patient a few photos, they just kind of go, oh, okay, right, that's fine, it's not too bad. But for the first second or two, they're always going to be a bit shocked. They've not seen this before. But then they kind of acclimatize to it. This is actinic keratosis, kind of mid-energy and kind of solar keratosis on the scalp. We can see a beautiful, it's only one treatment, 0.8 full surface and not 1.8 spot treating of the areas. And it's just a single treatment and it's gone, which is fantastic, especially if we're going to potentially precancerous lesions. Viral, papilloma, and that's just one treatment, 3 joules. We've just done one last week actually in the clinic, and it's worked fantastically. I'm going to post it on my social media. The viral wart's completely gone from a finger. Pigmented lesions, we can see kind of tiny speckles of pigmentation dotted about and some background pigmentation and redness inside the skin as well. We can see the redness is also reduced, which is more likely to do with the fact that there's improved skin architecture and regeneration, which just meant that the blood vessels are in a better nick and they are better formulated now and have better root and access systems, less likely to form rosacea-prone or superficial inflammatory blood vessels. We've got pigmented lesions here, which is fantastic. We've got loads of experience now with that. We're getting rid of kind of solar lentigos, and I'm not sure what you guys call it out there, litigines, or I'm not sure what your exact terminology is. It's called various different things. But pigmented lesions on the whole, generally, whether it's even potentially from photo damage or whether it's from things like post-inflammatory hyperpigmentation, this will lift it, which is fantastic. And then you're going through to the deeper treatments now, but patients who've got kind of, you know, severe rhytids and sagging of the skin, it's absolutely fantastic. And I honestly, and it sounds like I'm being biased because I'm doing a bloody presentation about it, but the honest truth is that I have seen more difference and more change on my patient's skin within 2 weeks of doing a medium depth Neogen treatment than I have on the same patient having done 3 very, very deep Morpheuses and waiting 3 months after the last one to see the full results. So after a 6-month journey with 3 horrible, painful Morpheuses, or using 1 session of medium depth Neogen, I've seen more results with the Neogen after 2 weeks. And I can hand on heart say that. And it's not just one single case. I've had loads of cases like that now. So to be honest, the Morpheus in my clinic is just gathering dust a little bit at the moment, I'm not going to lie, because I've got my new piece of kit it's all singing or dancing and seems to be fixing all my problems for me. This is a fantastic result. You can see there's improvement in the skin texture and the quality, obviously the rhytids and sagging, but also you can just see interestingly, it's so interesting how we can see the confidence of people through photos. And I can see that even the way that the person is looking, there is more hope and there's more confidence inside the patient's eyes in the after photo than there is in the before. And it's a kind of an unsung skill that we have when we look at before and after photos, we can capture the essence of what it is to be human. And you can see it here. There is a level of confidence, which is ultimately what this is all about. That's what the game is about. And all my patients that have had it have said they've got an increased level of confidence and they feel better in themselves, which is ultimately what this is all about. So Peri-Orbital, this is exciting. We don't need surgeons anymore. We don't need blepharoplasties anymore. We're doing them all by ourselves without a scalpel at all. And I've had a few results like this for fantastic for lid lifting, and the kind of saggy skin underneath the eyebrow has been tightened up, even sometimes with a kind of an averagely superficial treatment. A few of them, it's had remarkable effects on tightening the lid skin. And I'll show you a few of those in a minute. And again, so facial lids, so facial rhytids and on low energy. So this is a 0.8 level energy. We can still see there's improvement and tightening in the peri-orbital tissues and kind of a fantastic rejuvenation of the under eye as well, which is always an area where all of my patients are constantly complaining about. And there's only so much filler and Botox you can use before you need to give it a rest. And this is where this kind of technology comes into its own. I can literally resurface something, and I'll show you my practitioner who works in my clinic, my therapist. It's completely changed her under eye in the space of about a week. Absolutely fantastic. I've never seen anything like it. So this is a patient who I believe it has had chemotherapy or radiotherapy, I can't remember which. I think it's radiotherapy actually, and has had quite significant tissue changes after the radiotherapy has been administered. And we can see after the initial treatment, and then day 3, day 5, day 10, we can see it's almost completely corrected within a single treatment, which is absolutely fantastic and practically unheard of, in at least as far as I know. There's one treatment there with 0.6, 0.7 joules in the neck and across the full face. So you can see a really beautiful improvement in the skin quality. And those necklines are definitely something that's a bugbear for a lot of my patients. And within 6 weeks, yeah, we've seen very similar results. It's kind of completely obliterated them. There's nothing left. So obviously non-facial stuff, we can do hands, and you can do whatever you like. We've done décolletage, we've done hands, we've done legs as well now, actually. We've done some tummies, for the level of tightening. But here we can see improvement in the dermal thickness. We can see reduction in pigmentation and lesions. And overall, the skin just looks in a better condition. There's a thickening to the skin and a more rejuvenated appearance, which is exactly what we want. And scars. So scars, again, this is an off-label use, and obviously you can tell from the photo that those people are not, well, the one on the left anyway, is not a type 1 to type 4 candidate. So you can see that it's obviously a darker skin type, but you look at that level of improvement, that is absolutely fantastic. You know, normally this was left into the realms of plastic surgeons and skin grafting, but you don't need to do that potentially anymore. We can see improvements, significant improvements with just stuff we can have in our offices, which is exactly what we want to hear. And this is, I think, a post-mastectomy, and there's a reconstruction that you can see the improvement in the scar quality, and this across there's one that goes obviously across the forehead, quite delicate areas, and very visible. So it's definitely going to have a big psychological impact. So to help improve those kind of things can mean the world to our patients. Combination treatment. So we know that we can combine it with surgery, with suspension threads, with injectables, PRF, tightening modalities, and I do that on a regular basis. I'm going to show you some results from that. So my experience, I bought it back in March time, I believe. Simon, is that right? February, March, probably. I bought my machine, so we've used it almost non-stop. Hasn't turned off since then, which is fantastic. And we really pushed it hard, and it's done so well, and it's just a self-fulfilling prophecy now, to be honest. This is my wife, Sharon. You'll see me doing her treatment in a few minutes, and this is some of the treatments that we've been doing in our clinic. Looks very scary when I'm zoomed in and paused it, but you can see it's just at that exact moment we've stopped the camera on the video where you can see the plume of energy as it hits the skin surface. It just looks absolutely fantastic. These are some of my patients. So this patient had a very unfortunate situation. She is a 68-year-old female. She's had one treatment with me, 1.8 joules, which isn't very high, 4 weeks between. So originally she came to me and she said that she'd had permanent fillers done by a plastic surgeon about 25 years ago, and he completely cocked it up. He just, sorry, apologies, that's quite a British slang. He didn't do a very good job. And he essentially created a series of scars and permanent fillers that are kind of mixed into her tissues now, and no plastic surgeon will touch her. Nobody wants to put anything into her face. Nobody wants to go in and perform surgery. They tried once and it has a really bad outcome, so it hasn't been done since then. So her nasolabial fold, her lip itself, and the tissues surrounding those areas are all completely rock hard with a permanent filler that's over 25 years old now, which is really sad. She came to me because she wanted fillers, because she wanted me to fill in the bits of sagging skin and the shadows to try and create a better look for her. And surprisingly, I said no. And I said, no, I'm not doing that. I think that will add to the problem. It's not safe. Let's do something else. And I went for the NeoGen. So this was her day 5. And again, it always looks a bit scary when you just first see it. But actually, it's not that bad. It looks okay. Once you kind of get used to what they're going to look like, you can see and assess what state the skin is in. 4 weeks later, I was blown away. There is mass remodeling of the whole of the tissues. This has literally changed her life. She's so happy. Those little shadows and lines aren't there anymore in the same way. They don't bother her in the same way. The stuff she's been walking around with for the past nearly 20 years has suddenly become insignificant because we've been able to improve the skin quality, and that canvas has become tighter, which means those atrocities that are sat there 25 years later are less visible, which is exactly what she wanted. This is a patient who's had 2 treatments with me. So 1 joule, so relatively superficial, and you can see the progressive improvement in the skin all over the face and neck. We can see even around the mouth corners, that little tiny bit of a DAO line. We can see that little kind of inverted little shadow underneath the mouth corner. That's improved, it's lifted. There's significant lifting of the eyebrow and eyelid, and that's fantastic. She's so happy. I've managed to tighten the under eye skin, which for her was a big problematic area. And she's also got some sleep lines in her eyebrow. We managed to get those in a better position as well. Once that was done, I then went in and I dropped some threads into her face just because I could. And this is fantastic. So we can see how it can be used alongside other treatment modalities. Some people actually do the thread lift and do the Neogen directly on top in the same vectors as the threads to try and give more lift. So that's another potential tip or trick if you wanted to do so. So if you've got threads as a big part of your current clinic setup. This is a male patient who was attending his daughter's wedding in about 6 weeks. So he had a very short time scale and he wanted quick results. So we delivered 1.6 joules, a full face and full face treatment. We can see contraction of the nasolabial fat pads. We can see improvement in the nasolabial fold. The pore size it's not really sized anymore. It's just been obliterated. He's got this beautiful sheen to the skin. He doesn't look as old anymore. But the biggest difference is his eyelids. Look at his eyelids. You can see they've noticeably improved and lifted. And that's with a single treatment on a relatively low energy level. He was completely astounded. It's completely changed his life. And he looks super fresh for his daughter's wedding, and he's full of confidence, which is exactly what we want. This is my patient who has had a combination treatment with Neogen and a face tight case. So this is 3 months after I did the face tight and the Neogen. If you're interested in seeing it, you can go on my social media. So my Instagram is @dr.raj.theti. I'll write it down at the end, and you can see the video. I had a proper videographer come in and he videoed the face tight portion and then also the Neogen as well. So we went in to try and give her some skin tightening and improvement across the full face and neck. And I did a full face tight in the lower face and mid face, and then I went over the top of it with Neogen over the full face and neck. We can see improvement in the quality of the tissues. We can see the brightness in the skin, tightening of for instance, the under eye area. You can see that little under eye hollow. That we didn't put the face tight up there. There's been no face tight in that area. That is purely from the Neogen. The upper face area is all Neogen only. Haven't done any face tight there at all. So we can see beautiful contraction of tissues and really, really lovely result, which has improved her overall appearance. This is that cute old lady I was talking about. So I knew she was going to make an appearance. So this lady traveled about 2.5 to 3 hours to come and see me, and we've gone a bit berserk with her and gone super deep because we've had a lot of. She's not actually that old. She's only 64. Bless her. She's had a hard paper round, is what we say in the UK. She's had a hard paper round, and she's bless her. She's worked as a farmer for most of her life, and has had a lot of sun damage. She smokes, and she's got this kind of leathery solar elastotic skin it's very, very hard to manage, and dermal fillers or anything else isn't going to do anything at all. It's not going to help her at all. She would normally be a candidate for something like a fully ablative CO2, and to get this result within about 1.5 months and having 2 treatments, one slightly more superficial and one slightly deeper, it's absolutely phenomenal. That color that you can see, people say, oh, why is she suddenly white? She's not white. That was actually her skin color. She's slightly erythematous still. She's still healing, but that white is actually her skin color. And if you look at her arms, they are that color as well. The kind of orangey, goldeny brown color that you can see in the skin in the before photo is pure sun damage. That is just pigmentation that's been sat in the skin year on year on year on year, building up and building up and building up. And within 2 treatments, I've completely changed her race, basically. It's fantastic. We can see her actual skin color. Look at that neck contraction. There is nothing I can do in my clinic that's going to do that. Not face tight, not Morpheus, nothing's going to do that. I was completely astounded. Don't get me wrong, she had a very interesting downtime, and there was a bit of swelling and there's redness and lots of kind of photos going backwards and forwards to see whether everything was okay, and it was fine. But we can see that the end result is worth it for her. She looks fantastic. The reason why there's lighting differences just because she hasn't come to see me back in clinic yet after that treatment. So apologies for that. I think I'm a stickler for trying to make sure my lighting is the same in all my photos, but she just hasn't had a chance to come back to my clinic yet. But she sent me that photo from her house, and I thought that was very good. That was good enough anyway for me. Just to zoom in on her eyes, I mean, look at that under eye. It's completely changed. That is a surgical result until proven otherwise in my book. Anyway, there's a lower blepharoplasty she's had. She's tightened up those tissues, and she's a bit erythematous. She's slightly red, but she's still healing. Bless her, she didn't have the best skin quality in the start anyway, so that erythema will naturally settle down as time goes on. But I've managed to get right onto her lids and secure it and try to make sure that we tightened up as much as we can for her. So I'm absolutely flabbergasted. I'm so impressed with that, because I know I wouldn't have been able to achieve anything else. The closest thing, as I said, would be something along the lines of a CO2 treatment, but with that, you're going to get extended periods of downtime where you're looking at something, along the lines of potentially 2 to 3 months before everything completely normalizes. This is a patient who's had, interestingly, Morpheus 8 and then had Neogen. So this is a combination of both Morpheus 8 and Neogen, which, my Morpheus colleagues would probably say, oh yeah, as you can see, it's done more, the Morpheus has done more benefit than the Neogen has. And I would beg to differ, because I think she's only had a very superficial Neogen treatment. It's 0.8 joules 4 weeks after. Fit and well, young, but the only problem with her is she's actually got a collagen deficiency disorder as well. So we were unsure as to whether she was going to make collagen, and we were very, very wrong, because this is her after her second treatment. So we did her, so she stopped having the Morpheus and then waited till the Morpheus had showed its full results, and then I went over with her a much deeper treatment, which was I think it was a 2.5 joule treatment. Sorry, so this is the original before. And then after we did the 2.5, so we can see this huge difference in the way that the lifting has occurred inside the face. There's textural improvements. You can see the glow in the skin, and you can see the glow in her as well. You can see the confidence has improved. She's holding herself. She's literally singing my praises on all the Facebook forums around the world, telling everyone that Neogen is the best thing since sliced bread, which is exactly what I want, because it's an amazing marketing stream. If you've got one of your patients to shout loud enough, you just have an endless supply of patients. It's exactly what you want. This is my practitioner, Sophie, who I did in clinic. This is her day 6 after the procedure. We can see that's quite a typical kind of post-procedural day 6. This is her on day 8. So all of the stuff had been wiped out. You can see the skin slightly erythematous still. There's still kind of blotchy little marks here and there, but generally still well. We zoom in on her under eyes on day 8. You can see that obviously there's a small level of edema, but that's fantastic. It's completely obliterated it. A month later, she's a different person. There is lifting in the lower face, reduction in the nasolabial folds, improvement in the pigmentation. So if you look around her eyes in the before photo, you'll see that there's a darker patches around. And, I thought that was shadows, but actually when I looked closer and I stretched the skin, it's not shadows. There's actual pigmentation all around her eyes, and it's completely got rid of it. Her under eye area had that small area of crepiness and sagging under the skin around the kind of slightly herniated infraorbital fat pads. And they've just tightened up. It's like they were never there in the first place. She's got a level of lid retraction, which is fantastic, and improvement in overall glow in the skin. She feels so much more confident, and she loves it. She's ready for round 2. So next is a live demo. I hope that's been useful for you. I'm going to just ask Jonathan if there's anything else that he wants to say before I switch over to the video.
No, thank you for that, Dr. Raj. We're yeah, the live the demonstration that you're able to show now, that would be great. Thank you.
No worries. I'll do that right now. Give me 2 seconds. Hi guys, hope you're well. Yeah, so it's Dr. Raj. So I probably should have done the presentation portion of this webinar. Now we're going to move on to the practical. So this is my wife and partner in crime. She's a dentist, but she's a clinic manager here as well for me. So for today we're going to do a Neogen treatment on quite a light level, because she's obviously of Indian descent, but we can still take it quite nice. If we did a few treatments, we'll be able to get a really nice rejuvenation result for her. So we're now going to show you the machine. Okay, so the machine's over here. So this is the Neogen machine. I've got the PSR here, and in the UK there's a few available, but the PSR I think is the one that you guys are going to be able to see. So there's a few little bits. There's the main screen of the device, and then we have the handpiece that comes off. So we're using the superficial handpiece at the moment, but we will be doing the deeper handpiece in a wee second. So if you want to come around here, I'll show you the back. At the back of the machine, we've got the on and off switch here. So we're just going to turn the machine on, so you can hear it firing up. And then down here, if you can see, there's a little nitrogen canister there. And I'm just going to turn the canister on so that we've got a good gas flow. Okay, that's brilliant. Okay, and if we go around to the front again now, you'll see on the screen there is basically it's going through some of the safety checks to make sure that and it does this every single time you turn the machine on, which I really like actually, just to make sure everything is safe. So it's got to this number, it's paused at 33, which means that I need to now press the foot pedal. So I'm doing that over here. I'm pushing the foot pedal down, and as I push the foot pedal down, it will then start to continue counting down and doing further checks related to the handpiece to make sure it's firing appropriately, safely, and making sure the energy level is correct, so it's not overfiring or underfiring. So I said that's the only thing you've got to do when you turn it on. You're just going to do that nice little check, about 30 seconds. Are you okay? You well? Okay, good. So at the end of the 30 seconds, it's just going to do one blank fire just to see how everything works, and it should give us all ticks, and everything should be fine. There you go, so you heard that. That was the fire. So now I've just come through to the login screen, so I'm just going to type in my code. And then we're through to the main dashboard of the system. So there are various different buttons here. It all looks a bit confusing. The most important things to see are this number here, which is the number of shots available and left inside the nozzle. So the nozzles themselves will come off, and these are detachable and replaceable as a consumable for the machine. And this is also, so that's currently telling me there's 1,131 shots available in this nozzle at this level of joules. And there's also about 36% gas left inside the canister. So obviously we've got to make sure that doesn't run out completely, but that's fine for now. So it's just telling me some information about, it gives you a lot of safety information. So the treatment mode is a spa at the moment. So Fitzpatrick is happy for 1 to 4, and she's about a 4 or so, I'd say. But I've treated 5, and you can treat 6. You just got to be careful. There's got to be. That's the one thing with this machine is that you can treat all skin types, and I've got clinical experience for that. I know that it works. I've had it myself, and I'm more of a 5. So treatment intervals, it says a minimum of 3 weeks between. Gives you all the information you need right there, which is great. What we're going to do is we're going to put the energy at 0.6 joules, which is quite a good amount for a first treatment. She's not had it before. And then we're going to go into treat. When you click on treat, it's going to ask just to make sure you double check everything, make sure you're happy with everything. Actually, I'm not happy. I'm going to go up with this is the number of hertz, so the number of kind of pulses per second. So we're going to go 1.5, which just means it's slightly quicker for her. And then we're going to go to accept. So you can see it's warming up, and now it's still in standby, and then it says ready to fire, which is perfect. So that means this is now ready and loaded, and it's going to start firing soon. So what I'm going to do now is I'm just going to spin this machine round ever so slightly, just so that we can see it from the other side. It's got a nice little, I'm going to start down here on the jawline, and what it's going to do is it's going to start to vaporize some of those superficial little fine vellus hairs that we can see. So just check it for me a little bit, Dylan. That's great. Okay, so we're going to start in the corner here. I always do a little just test shot on their arm first to tell them what it's going to be like. So if you just give me your arm, Dylan, is that okay? You ready? Okay, how's that feeling? Is that okay? Yeah, so we're going to do it over here. We're going to start. So what you can see when we're firing the shot, you can see hopefully, can we see that? Yeah, can we see the shot? Yeah. So we're going to be, and as those shots are fired, obviously the numbers over here decrease. They decrease as the shots are fired. So we're going to start over here, and we're going to start in the corner. Are you ready, Daddy? Yeah. Okay. So we're just going to go around into a little line here, so we can see. How the shots fire. Okay, so we've just changed the angle up a little bit just so we can see the shots being fired. I'm just going to fire it across so you can see it's hitting the skin I'm just hovering with the handpiece over and making sure there's quite good overlap between the points. You can see the plasma is hitting the skin surface, and it's probably not very visible on the video here, but what it does is it creates this beautiful sheen of on the skin, which is really good, and that's a kind of a giveaway of where you've been and where you've got to go and what's remaining. So on the higher energy levels, we can do probably a full face within about 15 minutes or so, and this can be done. This level can also be done by a practitioner or a therapist. So I'm just currently going over, and what it's doing is pulsating, it's hitting the outer skin layer, making the outer layer of the epidermis non-viable, and creating. Yeah, that's good. Are you okay? Mm-hmm. Yeah. So it's creating this this non-viable layer, under which there is going to be an area, what we call kind of the area of modulation. So it's going to be an area of ongoing stimulation and improvement. And we can see. You okay, darling? Yeah. Yeah. So we're just going to do this corner here. So it's not terribly complicated. It gets a tiny bit more heated on the bony prominences, but still not too bad. How bad is the pain out of 10, Sharon? 10 out of 10. Oh, 10 being the worst pain in the world and 0 being nothing. How bad is it?
1.
1? Okay, that's fine. That's brilliant. Okay. Okay, so you can see it's just zapping away. You might have seen a little plume of smoke there. That's just the vellus hair being zapped away if there's any vertigo. So I've just got one of these little silicone paddles. These are really, really useful, and they're very, very cheap. And we can basically just use it to hide some of the hairs. She wouldn't appreciate me saying she's got sideburns right now, but that's basically what she's got. So we're just going to go through, and as we get closer to things like eyelashes and eyebrows that obviously these ladies spend a lot of money on, we don't want to ruin those, so we can use the paddles to protect those areas, and even if they get hit with energy over the top, it doesn't actually get translated through down to the skin, which is great. So I'm going to do her under eye now. So the way we do that is we just get them to open their eye for a second. I'm just going to gently touch the undersurface of the eye and then curl upwards, and we can see it's basically just caught most of the lashes. We can just start here and stay really still for me. Well done. We're just going to go into there, and this is really great for helping improve the under eye fine lines and wrinkles and improve. Well done, well done. It's always a bit zesty around there. You okay? Mm-hmm. See, not an eyelash damaged at all. Okay, and now we're going to go and do the upper lid. So the way to do that, we can start out here, and we can just start firing. 1 second. There we go. And we can see it coming across. We can just change our position and go all the way over, which is fantastic. We can leave a few rows on the eyelid, and it's amazing for tightening up that upper eyelid skin. I kind of call it a soft blepharoplasty. I think that's the best way to describe it. It's not a surgical blepharoplasty, but to be fair, you could probably, you can incorporate this at the end of a true surgical blepharoplasty. You could go over this area to further tighten up the skin and improve the surgical result. I'm just going to get down to the level of the globe, and now I'm going to use this thing, the paddle again, to hide her eyelid, and then we can just do another few rows a wee bit further down. We don't want to go over the tear ducts, so we can hide those and then do right into the corner and get right in there and give her a few different shots. While I'm here, I'll just do the side wall of the nose as well, so I can do the ala and just remember to really get into the nooks and crannies and the crevices. And then I'm just going to be going through, and that's okay. You alright? Yeah. Amazing. Okay, so we've done the upper eyelid, I've done the lower eyelid, I've done most of that cheek, which is great. I'm just going to come up this side now, so we can just cover some of that hair this way. So you can see there's little tiny hairs here that are just growing. Just got to be careful because some of them will be zapped. As long as you're consenting to that in the middle of the process, then it should be fine. You can see it's quite loud, but other than that, patients, If you're finding that uncomfortable, you can always sometimes use earplugs for my patients just to make sure they're a bit more comfortable. Normally play a bit of music in the background, but obviously for the sake of the demonstration, I haven't done that today. I'm just hovering over the skin. What you don't want to do is drag the skin with these things, because we don't want to create tears in a very, very, very superficially traumatized epidermis. So just turn that. I'm just going to go over the upper lid. Turn that. I'm going to go over the upper lid. I'm just going to start there. And do a few more rows just to make sure that she gets all of the energy she needs. Well done. Amazing. Okay, and then open your eyes for me, and then just straight up. That's fine. And then close your eyes. Brilliant. Just quarter your lid. 1 second. There we go. Brilliant. Okay, and then I'm just going to go under the lid as well. Okay, starting over here. So just try and tighten up. Helps to improve the dark circles under the eye, and I'm just going to do one more row right next to the lashes. There we go. Good, fantastic. You alright?
Yeah.
Amazing. Okay, a little thing slipping off, but we don't need that anyway now. Let's do the inner part of your eye here. A few little mono or brow hairs. Let's get rid of those. There we go. And then we're going to do the bridge of a nose. So we can just go straight down the nose. It's going to be great for helping to tighten the pores and reduce the oil load in the skin. We can see great textural improvement in the pores after even a single treatment, which is fantastic, which we've seen quite reliably in most of our patients post-procedure. Okay, can you curl your lips inwards for me, Danny? That's brilliant. We're just going to do the upper lip. So just gently doing that. It's not a problematic area for her right now, but it's just more for prevention and making sure that we can really help. Her main issues are pore size and tiny bit of skin laxity, which is what we're going to try and hit. And then we're going to do the same thing here. We're going to do around your corner of the mouth. So here we can see there's a tiny bit of darkness here. I'm going to try and get some of that hyperpigmentation. I'm just going to hit the oral commissures. And then I'm just going to work my way around the chin. Just got to be careful with the spacing between these plumes, so making sure that it's tight and uniform. And then just going to go over and basically from an angle and from afar we can just hit it kind of non-specifically and just gently feather in some of the energy into the upper neck and surrounding skin. And just holding it further away just means less energy will be hitting the surface, which means it's not going to get a full treatment, but it just helps to stop that line of demarcation, which is quite telling that a treatment has occurred. Amazing. Okay, so the full face has now been done, which is fantastic. Okay, so finally, I'm just going to switch over to the other handpiece, which is for the deeper energy, and I'm just going to show you how that works. Okay, so. Yeah. So we're just going to quickly switch over to the 5mm head. So this is the 25mm head. So we're going to take that off, and then we're going to switch over to this one, which is the 5mm head, which is the higher energy head. So you can see it's got a lot shorter little spout there to hold it close to the skin surface. And then what we do, if you look over here, we can press change nozzle on the machine, and that will automatically recalibrate for the higher setting. So now it goes up to 1, but obviously we can go up to energy level, we can go way higher. We can go up to 3 or 4 if we wanted to, so we can go as high as we want. But for now we're going to stay low just because she's got an Asian skin type. We're going to go on 1, and I'm just going to do a little bit here to show you. This is a scar. We already pre-treated it once with a lower level of energy, but now we're just going to go a wee bit higher, just so we can see this treatment in action. Okay, and then we're just going to hold it there. You okay? Mm-hmm. Yeah, great. So we're going to start now, okay? Here we go. So this is a surgical scar And actually what we can do actually with the one is we can go up with the hertz. So I'm on 2.5 hertz now, so it's going to be much more rapid, which is fantastic because it just means it's quicker for the patient at the high energy level. Yeah. Okay, so we're going to go for the high energy treatment. Here we go. So you can see this really quick firing, and just going over that surgical wound. Going back over. There we go. Well done. I'm just going to go down the other side as well. Fantastic. Amazing. Amazing. That's really great. Well done. You can see instant changes to the surface of the skin, and we're just going to do a light bit around the edges where these little kind of train track stitch marks are, and then we're done. Okay. So really fast and beautiful result. It's already improved by probably a factor of maybe 20 to 30%, even with a single superficial treatment. And I'm just going to do a few plumes from afar, just to make sure that it doesn't look like it's being treated by itself, and it feathers in with the skin around it. And that's it, done. So, as we can see, there are so many different indications and applications for this technology. And we use it for loads of different things in the clinic now, things that we didn't even think we were going to use it for. And we're just constantly finding new applications on a daily basis where we're just trialing and testing little things. And I think that's where the real power of this machine comes, is that we don't really fully appreciate what we can and can't do with it yet, which is fantastic. So we're pushing the boundaries, there's new frontiers. It's a very exciting time to be with Neogen, so I'll hand myself back over to myself in the presentation room, and I'll see you very soon. Thanks, bye. Okay, Jonathan, can you hear me?
Perfect. Yes, I can. Yeah. Thank you so much. Thank you so much for that, Dr. Raj. That was fantastic. We've got some questions that I'd like to go through. I am mindful of time, so thank you everyone for being with us and continuing to engage. We've got some great questions, so I think it'll be a mixture of both Simon and Dr. Raj answering these. So I will start. Okay. So first question, has your wife had any topical pain management during that treatment?
So we did a 4% lidocaine cream for about 10 minutes or so, and that was it. And then I wiped it off just before the video.
Perfect. Thank you. The next question is, looked like they may have been in pain whilst doing the arm scar.
Yeah, well, she's quite pathetic, I'm not going to lie. And I also didn't put any numbing on her arm because I suddenly thought of it at the end of the presentation time. But so I just thought, just grin your teeth and bear it. But she was fine. She was okay. And she's actually got COVID at the moment, so I wanted to try and take a photo of her arm, but unfortunately it's not been possible for me to do so. But there's been improvement in the scar, and the surrounding tissues have become a lot more lighter, and it's just looks like it's just airbrushed is the way that I would use. It hasn't gone away. It's a nasty scar from her youth, but it's now a bit more airbrushed, which is fantastic. But that's purely my fault. I forgot to put the cream on her, and it's your wife, so you can do those kind of things. It's fine. There was no consent form signed or anything. It's fine.
Thank you for your honesty. Thank you.
It's fine.
Any contraindications with patients with fillers, thread lift, Botox, and recent rhinoplasty?
As far as I'm aware, no. And actually, it can be used alongside surgical procedures. So, for instance, some plastic surgeons will do a surgical blepharoplasty under, for instance, local anesthetic. And at the end of the procedure, they can blast over the whole area with their Neogen system, which means they get further contraction and tightening on top of their surgical result, which is fantastic. With fillers and with other, so you said threads as well, they're using threads alongside procedures. So I've done threads and then done the Neogen on top. Other people are doing that as well. And there's no evidence at all that anything, that Neogen will have any impact on the effects of toxin or filler. There's no evidence for that whatsoever. And I regularly do, and as showed you, that there's patients who we had filler in previously, who we did Neogen on, so there wasn't any contraindications there at all.
And just to build on that one on the injectables, so the ideal such scenario is that you would treat with Neogen, then put your injectables in, ideally, but you can actually put the injectables in, and then Energist says give it 2 weeks, you can then treat with Neogen. But Dr. Raj is correct. There isn't going to be any effect because it's been injected quite deep into the skin, and we know that that energy isn't going to go that deep. So it can be used in combination with injectables and threads and surgery.
I found that for my patients, you're exactly right, Simon. I think that the moment you've done the Neogen and you can see contraction on the skin, if the canvas is tighter, they just need less stuffing. If the pillow case is tighter, they just need less stuffing inside the pillowcase. We found that, and it means that we've needed to use less filler, and the results have been better because we've been able to contract that canvas first.
Perfect. Thank you. Max joules in orbital area and how many shots approximately?
I think I'm going to go over to Simon for this one because I don't know what I'm allowed to say.
So I'd say you're always going to be starting with what skin type and what the person is, and what is the condition of their skin in terms of your first determination, and their attitude to downtime. And once you've kind of worked that out, as Dr. Raj has said, it's better if you can start a little bit lower and then build up to another treatment which is higher. But if you don't have that luxury, then if the customer is looking for a one and done, and let's say they're skin type 1 or 2, you really can put a lot of energy into the eyelid directly. There's Dr. Marina Bacciurina, who is using very high energy and several passes on the eyelid, and getting great results without any issues at all. I'd say that around the eye area you can put in high energy, but you've just got to be careful underneath the tear duct area, because that area is obviously quite sensitive and has got less structure there. So you would dial it down a little bit underneath the area and underneath the eye by the tear duct, as I've been informed by Dr. Michalis Ketchadias in Greece. That's his advice.
Next question, does it work for vitiligo?
It's a contraindication, so we would not use it for that.
I wouldn't treat it for vitiligo or anything along those lines, because you could potentially, the Koebner phenomenon means potentially you could set something off, which wouldn't be ideal. So it's a contraindication.
Thank you. Can a trained esthetician perform the services superficial and deeper?
Simon?
So yeah, this device, it has, when we talk about the PSR, it has various logins, so you can actually delegate the lower energy to an esthetician's therapist for them to have exclusive right to that login level, whilst the physician can use the higher level if you want to be very clean in terms of your delegation. But in terms of the skill set required, it's very easy to use. So it's not necessarily about the skill, because it's virtually the same treatment to perform at low energy as it is high energy. This treatment is about looking at determining the right energy to get the right result in the first instance, and then the delivery of the treatment is about making sure that you coat the skin with the plasma completely, and not leaving any area of that skin untreated. So to answer your question, that yes, you can, the more junior members of staff can use the lower energy, whilst the physician can use the higher energy. And obviously in med spas, maybe where there's a a medical doctor or a medical director supervising, then potentially they can work out that kind of energy levels between themselves in terms of what's appropriate.
Thank you. Next question, your preferred post-treatment products and protocols?
So I think it depends on the level of energy you're using. For our clinic, and I mean, this is, Energists may have specific protocols they use, but we've developed our own. We're using a lot of growth factors from one of my colleagues in the UK who has very well established growth factor brand, which reduces downtime. And what we advise, we use something called Cellderma, but there are other international products available, things like we've used previously as well, just to help reduce the downtime. But it's just initially, just after they've had the procedure done. On a superficial level, we then really don't want to put anything on the skin because we're gonna prolong the downtime. So once those growth factors have been applied to the skin, we just don't put anything else on for the lower energy levels and just wait for the skin to do its thing, and then they can use sunscreen, all those things after they've had the skin peel off. Just because if you start patting things down with moisturizers or that, and they will feel dry and they will feel tight, but it's just part of that information you need to give them to say that this is okay. You need to feel like this a little bit for a few days. If they're going for a deeper, medium or a deeper treatment, we would use a kind of a barrier emollient. We've got things like Aquaphor, which we can put over the skin, and we give them a little tub of it to take home. They use that for about 3 or 4 days until they start to see the skin crusting over a little bit, and then we just tell them to stop it. It's just for the initial phase where we don't want kind of infiltration and dryness and transepidermal water loss through something that's slightly more aggressively treated. So we want to make sure we protect those layers in the first few days just while they are still a bit more fragile. But then as they become more established and things start to crust over, we stop again everything until all the skin has stopped peeling and everything's back to normal again. Do you agree with that, Simon?
That was a really great answer. Yes, I do agree with all of that. And I would say that some of the other interesting aspects that you've mentioned in terms of the first 24 hours following a low energy treatment, or actually a high energy treatment as well, if the user does want to get some product into the skin, then it's a really absorbent period at that point. But you've just quoted the Energist's protocols very well there. So thank you.
Fantastic.
Thank you. Ever pre or post treat with hydroxyquinone?
Yeah, so I've again, this is the off-label piece as a disclaimer for patients who are skin type kind of 4 or above. I have personally stuck to only kind of the superficial treatments, but told them that they need multiple ones. We've still got really nice results, even with multiple superficial treatments, as I said, my case in particular. And in those people, I'm a bit more of a safety Sue in my clinic, and I try to make sure we prepare the skin. Sorry, it is getting through to about 1:45 in the morning here, so apologies if I lose all of my abilities to articulate. We would potentially put them on some hydroquinone just for probably 2 weeks before, and then maybe a few weeks after, just while they're healing, not during the peeling phase, just so that if they're doing it, we wouldn't do a deeper treatment anyway. So if it's just a superficial one, but again, I've got colleagues that don't do that and they're completely fine. But I'm just always a bit more hesitant and making sure that we're cautious. So I always load them all up with hydroquinone just for a few days, for a few weeks before and after the treatment.
Thank you. Next question, topical applied, anyone use antique GF solution? I'm
not familiar with that myself, I'm sorry. Is that something you know about, Simon?
Topical, what was it?
It's topical applied, anyone use antique GF solution?
No.
And is that growth factor solution or growth factor serums or something, I presume?
Possibly.
There are definitely growth factors that we can apply. I haven't come across that one personally, but as I said, during that period after they've had the treatment in the first 24 hours, we just tend to do it while they're still there. There is an incredibly absorbent period where we can really go in and throw in some actives if we wanted to. So we really want to make sure if there's anything you want to throw into the skin, then's the time to do it, which is another reason why some people also, and I have dabbled in this but not properly yet, is to put some PRF or PRP onto the skin surface. So that, to be honest, it's just a bit of a faffy extra step at the moment, because I'm just we're just changing over machines to a new PRF machine, but it's slightly more faffy. But if you can get it, and you can get it in at the right time, and it's not clotted and everything else, it will be a really, really good time to throw it onto the skin, because you're going to get all of the benefit of the stem cells and growth factors from the patient's own blood at the same time.
Perfect, thank you. Next question: does it work for melasma?
I'll try that one. So I'm speaking with Dr. Lee, who has used Neogen extensively in Singapore. He says that Neogen is really, really good at making that membrane, the DE junction, much, much stronger, which is more of a preventative measure about, pigmentation rising from the dermis through to the epidermis. So that's more of a control aspect of Neogen in terms of managing pigmentation such as melasma. But I think it's a little bit hit and miss with regards to melasma. So I've heard of some good stories in terms of how it's been used, and I've heard of some not so good. So I would treat cautiously there.
I think the case is with melasma, anybody who's treating melasma will know that it's incredibly volatile and nenever follows any kind of strict pattern. And to think it will is foolish, and shows that people who have treated it haven't understood the properties of the way that the condition works. The natural history of the condition is that it's a volatile condition. So I wouldn't personally promise anything to my patients for it. I haven't personally tried it for myself with melasma. And the thing with melasma is it's never going to be completely cured. You can only ever manage it, but there's always a risk of rebound. And if you were going to do something along those lines, I would personally advise you don't. But if you were going to, you definitely want to try and potentially prepare the skin on some kind of tyrosine inhibitor prior, to make sure that you keep them as safe as possible. You don't give them the risk of more potential pigmentation secondary to having a treatment. But that would be the same with any treatment that would potentially cause thermal injury or damage to the skin.
Thank you. Next question, Neogen in conjunction with threads, interested in guidelines and protocol. So we can potentially connect you up post webinar to exchange those, if that's okay with you, Dr. Raj.
Absolutely fine.
Perfect. Next question, recovery days. What do you mean? Is the skin red? Can they go out? What will they experience? I think some of these questions came in a bit earlier on, and they may have already been explained through the presentation now.
Yeah, I mean, I think it just depends on the depth that we go to and the energy level that's used and the skin quality and the patient's perception of what downtime is. And the thing is, everyone's perception is different. I've got patients who are happy to have their face fall off 4 joules, and that's okay for them, and that's not really anything problematic because they're just going to be sat indoors in anyway. I've got other patients who are socialites, social butterflies, and they don't want, even a freckle of pigmentation or anything dark on their skin. So I think the word downtime is quite relative, and it needs to be taken very carefully. We need to show photos of evidence of what previously happens with other patients we've treated or other people have treated. You haven't done many yourself yet. And then also you got to show them, roughly. I always try to find pictures of people who are similar to the person who sat in front of me, because then they see themselves in that situation and they can see whether that's going to be something that they're going to like or not. And you've always got the option, if you are going to go for a deeper, if you don't want to handle that downtime associated with a deeper treatment, medium depth, well, for my patients, I tend to say superficial is going to be 4 to 7 days, roughly. A medium would probably be maximum 10 days. and for a deeper treatment, it'll be maximum 14 days. And within that context, I show them the photos of what it's always going to look like on the worst day. And I always show them the worst photo I can, so that you can kind of under promise and over deliver. That's the way that I would say it's the best way to do it. So show them, paint at the goriest picture, and then, you know, we can all, they can pray and hope and make sure, and they'll be absolutely ecstatic when it's not as bad as the photo you showed them. Then that's always positive for them.
Dr. Raj, I'm just going to play back some of the words that you've spoken previously around this technology. There is downtime associated with a Neogen treatment, and you know, it's about how you explain it. But I think what you said before is if that patient is prepared to go through that downtime, they are going to be very happy with the results at the end. And it's just about that customer expectation.
Yeah, it's like the flight to Hawaii, not the flight, the trip to Hawaii with a pedalo boat. That's the way that I would describe it to my patients. And then everyone always wants to go to Hawaii.
Perfect, thank you. So we've got some longer questions here, which may take a little bit longer to answer. So Neogen PSR can be used in other parts of the body like abdomen, legs and arms. If yes, which are the recommended energy levels to use in the larger areas to treat stretch marks, older scars, and for tightening of the skin?
So I'll go for that again. You know, we keep talking about, we've got to titrate the energy based on what the skin color, what the condition, and what we're trying to achieve with the relative downtime, attitude to downtime, whether they want one treatment or whether they want multiple treatments. So to answer that question in the kind of one bullet point is not possible. But there is, the Neogen is FDA cleared for the neck, hands, and décolletage and face. And there are some doctors treating off-label, and they do treat for stretch marks, tummy tightening, tightening on the arms. So generally it can be used in other areas according to successful doctors. In terms of the energy level, off the face, the recovery is much longer and sensitivity is much higher. So you actually have to dial it down slightly from what you're treating on the face to what you put on the body, depending in terms of what you're trying to achieve. So probably not answering the question fully, but I'll let Dr. Rice add to that if he wants in terms of what he's seeing.
I think, yeah, thank you. Thanks, Simon. That was very interesting. I think the off the face things, obviously off-label uses on the body and stuff, so the cases that we've done, you know, we normally tend to try and go with the lowest energy level possible that we can in order to give them the least amount of downtime. The facial skin turnover is going to be way higher than, for instance, the abdomen, and it's the time frame of that skin cell cycle turnover. That cycle is already pre-programmed. There's not very much we can do about it. So they're going to have longer downtime. So it's better probably to have slightly more potentially lower energy, but then potentially more frequent treatments. So they might need a few more sessions to get to where they need to be. I don't know whether you agree with that, but that's what we've.
Yeah, you know, there are good success stories in terms of a higher energy, but there is really considerable downtime associated with those high energy on the abdomen. But you know, that's between patient and doctor to work out. But generally, I think doing a series of lower energies would be where energists would be recommending to approach those types of indications.
But importantly, Simon, I mean, the results after those series of lower energy or lower or medium energies or whatever you want to do, it's normally potentially comparable with if you did a single high energy treatment. Am I right in saying that?
Yeah, I think you get to a high percentage of a single high energy treatment with multiple low energy treatments.
Yeah, and a high level of satisfaction. And I think this is also a key thing I think is super critical with this company, with Energist. Every time I've had a scientific question, Simon has bent over backwards and basically gone and ushered my questions into the ether and into cyberspace, into all of his networks and connections across the whole world. with really, really experienced doctors who've got way more experience than I have in this, and actually they've come back with answers to the exact questions, and it's been really, really nice to know that there's someone else on the other side of the world who's also thinking about the same things I'm thinking and has already been through there and already had the question answered. And it's satisfying to know that we've got that kind of that connection and that network of experience across the globe, across different skin types and across different indications. People who've done it for a lot longer and have got a lot of experience, and it's nice to know that it's there in my back pocket if I need to ask. Then I've got Simon there, and he's always been very, very helpful.
Perfect, thank you. Is there any skin cooling required on the top layer of skin, and what skin scanner do you use, and where can they see the results?
So we don't use any cooling devices on the skin. I think part of the issue is that we want to try and keep the heat in the skin. Otherwise, if you start cooling it down, you could potentially, it could be to your detriment, and it could be the fact that you're reducing the overall heat inside the skin and the amount of effect that's going to produce. With regards to skins, I know other companies definitely do have cooling technologies, but I think, and in all honesty, we do use cooling with our Morpheus for radio frequency. Some people find that controversial, but in my hands, I think I can see really good results with it. But the Morpheus is slightly different because we're going into the skin and then the RF energy is being released deeper. With this situation with Neogen, it's going to be a superficial blast that's going to hit the skin surface. So we don't want to cool the skin, otherwise you're going to lose a lot of the effect. The skin scanner we've got in the clinic is an Observe system. But Observe, there are many other companies available, I'm sure I have to say or something, but there's the Visier, there's Observe. Those tend to be the main ones where we use an Observe in our clinic, but other clinics definitely use a Visier as well, where you can measure more accurately things like the hydration level of the skin as well, which I think has been quite important. So we're looking into Visier next.
Perfect, thank you. Got a couple of questions in the chat as well. Why not FDA approved for type 5 and 6?
It's just the FDA for Neogen was actually approved in 2013. So it's this device is clinically proven for nearly 10 years, and it's also field proven as well. So so it does date back to 2013 in terms of when that initial submission went in, around the 7 indications for the 4 skin types as well. So it's just a kind of legacy thing, basically.
Thank you, Simon. Is it possible to do a treatment on the lips that have had a permanent filler injected 20 years ago, skin type low 3 British?
Sounds like an example of what you did earlier for that lady.
Yeah, is it related to that case? I think.
Yeah, it was. The question is, would it be possible to do a treatment on lips that have had permanent filler injected 20 years ago, skin type low 3?
Yes, I did it, and it worked. Yeah. I don't know whether there was any other information they wanted from that. I think we initially did a little test patch for her to make sure it was safe, to make sure it wasn't going to do anything silly. I was pretty confident it wasn't going to, but I wanted to make sure she was comfortable, because she's obviously been through a lot of psychological trauma alongside that. So we did a little test patch, everything was fine, and then we went on and cracked on and did the treatment, and it's and on a relatively medium energy level. It wasn't even that high, but it still showed fantastic results.
Thank you. Next one, risk of PIH.
So I'll go first on this one. I think there's much less risk of having PIH with nitrogen plasma, with Neogen Plasma, than with light and laser, because we're using thermal energy rather than light, and light can more readily trigger melanin in the skin. So it's much less risk of it happening, and if it does happen, then it's usually transient and it will clear itself within a number of weeks, and that potentially could be accelerated by the practitioner if they wanted to accelerate that time frame to reduce it back to normal. So that's my answer.
Yeah, I agree. I don't think there's no way that we can completely rule it out. It's a very, very low risk, which is why, as I said, in anyone who's I'm using it kind of off-label with dark skin types, I would prep them anyway, just in case, even on a lower energy basis. I'm sure many colleagues probably wouldn't, which is fine, but that's my personal practice. But importantly, you're never going to be able to completely negate the risk. There's always a risk. The only way to negate the risk completely is not to perform the treatment. That's the same with any complication of any treatment. So I would never promise that we can't get PIH, because you can never say never. But with hand on heart and with the evidence in front of me, you can always have an informed conversation with your patient based on your experience and the experience of scientific parties before you, and look at whether it's a viable, real risk that we need to really consider. And if it's not, then that's fine. But you've got to just relay that to the patient.
Perfect, thank you. Next question, how does it compare to RF skin tightening? We use Cynosure Tempsure system. Don't know if you have experience of that, Raj?
I haven't got personal experience with that. Simon, do you know about that system or that?
Maybe we can answer the question in two ways, comparing it to just an RF device versus an RF microneedling device. So on the RF device, that's really not going to have a significant resurfacing effect compared to Neogen. So
it won't. Oh, I agree completely.
Neogen is going to give you a gold standard resurfacing, as well as the tightening, as well as the regeneration, and those are three things happening simultaneously in a single treatment, treating the whole architecture. And there aren't devices on the market that do that apart from a fully ablative CO2. So in terms of coming back to RF microneedling, I think Dr. Raj has already mentioned his personal comparisons with Morpheus, and I think he's made that quite clear.
Yeah, I agree completely. I don't think there's much more to say on that, I don't think.
No, I agree. I think some of these questions, like I said, came in earlier on in the presentation. So I've just got a couple more. Thanks for being with us. Can Neogen Plasma be used in the surgery room just after liposuction or a tummy tuck to tighten and heal faster?
I personally have not had the experience of that, but from conversations with colleagues and conversation with Simon, it sounds like it definitely can be used in those instances. Am I right, Simon?
Yeah, obviously we're talking about trying to tighten lax skin here.
Yeah.
So it does tighten lax skin. You would need the skin, I think the skin would need to be in or the wound would need to be controlled, in good shape. And I don't think you'd go right up and over the wound. You'd stay away from the wound slightly. But I think if there was lax skin to be treated there, it could be done at the same time. Or probably safer would be to just let that wound heal and then come back and treat it afterwards, which I think is more the common process, is to treat a number of weeks after, because that skin's not going anywhere, and it would probably be more convenient and safer to do it a couple of weeks after.
I would completely agree. I think it's always better to potentially try to stage the procedures. It just reduces the overall risk for the patient if we stage them, but also gives them some time to process what's happened. And sometimes they, it sounds silly, but sometimes patients just need time to process and see whether something is actually right for them. And, I'm always of the opinion that we need to give them time to consider their options. So I think if you stage it, there's always that extra possibility that, they may want to go a bit deeper, they might want to change their mind. Giving them the flexibility of that option is important. But yeah, ideally, it would be better to do it on a different time when it's slightly more in a better quality.
Thank you. Treating burn scars. How long after the incident can I treat the area? Can it be used to help the healing process? And also there's another question kind of related. Can it be used in MOH scars as well?
Well, it's quite a specialist one for me. I'd like to find out who asked that question and potentially send them some clinical papers to answer that properly. My general knowledge would say that I think the wound would need to be settled down and at a stage where it was appropriate, and then it can treat all scars. Keloids are contraindication. However, I know a number of doctors are carefully treating those, but in combination potentially with surgery as well. MOH scars, Raj, have you got any view on that one?
So kind of, I presume it's from Mohs surgery, which is for kind of invasive skin cancers. So again, it would probably be the situation that it would be for the scar revision after everything has settled down. But once you've got re-epithelialization of the skin and it's in a better quality, there's no reason why you couldn't use Neogen over those tissues. Once everything is healed and you know your margins have been met and everything's fine from a histological point of view, then there's no reason why you shouldn't be able to go in and help to improve the quality of the tissues.
So if that individual wants to reach out to any one of us, we have clinical papers on that particular subject and lots of other indications. We do have a lot of clinical studies papers, which are been written by some significant KOLs in the past, which we're happy to share.
Brilliant, thank you. And the last question, I guess it's for me. Will the presentation be available recorded? Yes, we are recording the presentation. Everyone everyone who's joined the presentation will receive a follow-up mail with a link to where they can view this. So thank you ever so much for everyone's attendance today.
You got the first question, I swear to God, it was.
Sorry, I had the easy one. Okay. So yeah, thank you again, Dr. Raj, for answering those questions, and thank you, Simon, as well for answering those. A great presentation. I think everyone will agree we've all learned a lot. I'd also like to thank Energist Medical Group for joining us today, as well as all of the attendees. I know we went on a little bit longer than we'd planned for, but I think having the extra time to go through those questions is really beneficial to us. It was a pleasure to have you all with us. So I guess this concludes the webinar. Thank you all for attending. We hope you learned a lot and enjoyed. So thank you very much, and we'll reach out to you shortly.
Thank you, guys.
Okay, thank you. Thanks very much. Thanks, Dr. Raj.
Thanks, everyone.
Jonathan. Thanks, everybody. Bye.
Have a good night.
We recording? Stopping recording?